Before a jump shot can take place, there needs to be flexion in the legs. Some of the main flexors in the legs that are responsible for the windup of a jump include the semitendinosus, semimembranosus, bicep femoris, gracilis, plantaris, and the gastrocnemius. All these make up the main flexors in the leg before a jump shot occurs. Then, once the flexors are contracted, the extensors will come into play and will contract to cause a vertical jump. The muscles that make up the extensors include the gastrocnemius, tensor fasciae lata, quadricep group, gluteus maximus, gluteus medius, and the iliopsoas. Also during a jump, plantar flexion is involved, and the muscles that are involved in plantar flexion during a jump are the gastrocnemius, soleus, tibialis, fibularis brevis, and fibularis longus, flexor digitorum, and plantaris. In basketball, ankle sprains are a very common occurrence due to the amount of running, jumping, and horizontal movement a player must go through. Typically, an ankle sprain will undergo inversion, causing the ankle to externally rotate, damaging the LCL group in the ankle. If the inversion has enough force to completely tear the LCL group, the talus might move medially, causing the fibula and tibia to migrate from each other, tearing the anterior tibio-fibular ligament, classifying this sprain as a high ankle sprain. In this clip, you can clearly see this player's ankle go under severe inversion, giving this player a high ankle sprain. And since the tibio-fibular ligament is crucial in plantar flexion, this player will have a very hard time playing in the near future.
During a swim dive, the gluteus maximus and the three hamstring muscles, the bicep femoris, the semitendinosus, and semimembranosus, along with the erector spinae, extend the back and hips shortly before the four quadricep muscles, which are the rectus femoris, vastus medialis, vastus intermedialis, and vastus lateralis, along with the tensor fasciae latae, extend the knee to allow the swimmer to launch off the block. The stabilizing tendons and ligaments are of the following: for the hip joint, the iliofemoral ligament, the ischiofemoral ligament, and the pubofemoral ligament stabilize the hip. For the knee, the MCL, the LCL, the ACL, the PCL, pectoral ligament, the oblique popliteal, and the arcuate popliteal ligaments, along with the tendons of the rectus femoris and the tendon of the semimembranosus and the IT band stabilize the knee. An example of a common sports injury involving the knee joint is a hyperextension of the knee. As you can see in the clip, the player, as he lands, his center of gravity forces his knee to bend backwards, along with excess force from the contraction of his knee extensors further causes his knee to go more posterior, thereby hyperextending his knee and causing an injury. The player could also have had tears in his ACL or PCL, along with the hyperextension of the knee. There are three steps to a baseball throw: bringing the ball back, throwing the ball, and the recovery or the follow-through. During the step where the pitcher is bringing the ball back, the posterior deltoid causes the glenohumeral cavity to horizontally rotate and adduct the arm. The anterior deltoid stretches to slow the lateral rotation, and the pectoralis major stretches to slow the horizontal adduction of the arm. The erector spinae and spinalis and the internal and external abdominal obliques cause the trunk to rotate and for added acceleration of the ball. During the motion of throwing the ball, the pectoralis major and the anterior deltoid conjunctionally work to medially rotate and horizontally abduct, moving the ball forward. For Tommy John injuries, The UCL is damaged, so much so that it needs to be replaced by the palmaris ligament. What causes this damage is either pitching too fast or pitching for too long. In the clip, you can see that the pitcher clearly dislocates his right elbow, which damages the UCL to a point where either he will need Tommy John surgery now or later in his career.